Hello, survivors. In this next hour, we hope to bring you some insight on how you can keep your feminine figure even after you've had a mastectomy. So we are going to talk about our prosthesis tonight. And my name is Lori Buckley, and we want to first of all thank our generous donators who support Project Pink and all of the things that we do here. So the programs like this we can bring to you free of charge. And tonight we have with us our experts for this series is Sandy Jensen, and she has been a certified mastectomy fitter for 14 years. She's a cosmetologist and has practiced that for 41 years. So you should be in good hands with her. No such thing. And next to her is Chris Da Silva, and she is also a certified mastectomy fitter, and she has been practicing at CHI's Renewal Hope Boutique since 2011. Mm-hmm. So there's been lots of advancements in surgical procedures and in technology, so a lot of things have changed in the world of prostheses. So we will turn it over to our experts and let them enlighten us with their knowledge. So show and tell times, ladies. Tonight we are just going to do casual conversation the whole time. And so feel free to send in your questions anytime throughout the night so that we can make sure we're covering everything you want to talk about. So
a lot of women, one thing we really wanted to show you ladies today is a lot of women who've had breast surgery do not realize that they have coverages through insurance for different types of prosthesis. So if you've had a diagnosis of breast cancer and you have a lumpectomy, there might be a void at some point during your healing that those things do not, that something doesn't balance. You may have a bra where you don't fill in like you used to. And so there are different prostheses for that sort of thing, as well as if you have had reconstruction, sometimes one of the breasts may be a little fuller than the other. Sometimes there won't be enough projection in the bra, in your surgery to fill up the bra. So we just wanted to show you some different things to balance that out. That really has changed a lot in the last few years.
I know one of the questions was, will insurance cover it? The answer is yes, they're required to. The Women's Health Act of 1998 requires that if an insurance company pays for breast surgery, they must also pay for prosthetics and the bras to put them in. And that doesn't make any difference if it's a partial mastectomy, which is what a lumpectomy is, or if it's a full, unilateral, or bilateral. How much is covered really varies from policy to policy. It's not even just insurance company to insurance company. Most are prosthetic every 2 years, one per affected side, and then the bras are anywhere from 2 to 8 per year. The average, I'd say, is 6, but that is required. So that's people think that if they've had reconstruction, like Sandy said, that they're not eligible, but they absolutely are.
And that's for Medicare and Medicaid?
That is for all insurances across the board.
Okay.
Mm-hmm. Mm-hmm. Now, Medicare, the one caveat with Medicare that isn't always carry over with the other insurance companies is that they require that you use a prosthetic in order to have a bra covered. Some companies will cover a prosthetic or a bra without the prosthetic, but Medicare and Medicaid
you
have to have
the prosthesis has to be necessary. Mm-hmm. Even if it's a partial. So, do you want to talk about more coverage or anything? Okay. So I would like to just kind of demonstrate and show you. We have a half a mannequin here. She's kind of heavy, but I just wanted to show you a little bit. Now, she normally, if you have a mastectomy, this is a full prosthetic. So this, that's the left and right. Let me get this one.
Yeah.
So you would be able to put that prosthetic in the pocketed bra and balance yourself out, okay? However, let's say you've got this is your natural side. And you've had some radiation. Sometimes that can shrink the side that you've had radiated. Sometimes that can change in size. And so let's say this is, this is your natural side, and this is the cancer side, and you've had maybe a lumpectomy, you've had radiation, but it's not, it doesn't balance now. This one's much smaller. So there are partials, and they come in different shapes and sizes. They're kind of a hollowed out partial. This is a triangle. We have, this is a sort of a teardrop, and they come in different, sometimes they come in different widths or density. So some will have a little bit more fill to them in the middle.
Show them the back of those so that they can see that they're... So that would be for somebody who's just had a partial or the lumpectomy.
Yeah, or even reconstruction, and one is
a little
off balance. Yeah.
Okay.
And so that just is placed in the pocket of the bra over the breast. So it's, and I think, I do have a bra here if people want to be able to see. But yeah, you would just take the partial, and it's put, it stays better if it's a pocketed bra. Some people they try to put them in their regular bras, and then by the end of the day they're kind of wiggling their way right back up. So anyway, so that fits in there, put it where it's necessary, and then it stays in that pocket once it's on your body, if it's fit properly. So, but they come in different sizes. They also come in, this would be one if someone had a lumpectomy that went underneath the breast, and they were missing a lot of tissue. Definitely that's going to be a different shape than a remaining breast. So this one has a lot of fill at the very bottom, so that could be placed under here. It could be placed on the side if they've had a lot of lymph node removal, but it just kind of, it's all about different matching that shape up to the surgery site. So that's those. What do you want to check?
One of the questions I know that was sent in before the program tonight was, how soon can I be fitted after surgery? It varies a little bit from person to person, but I wanted to go through kind of the stages and show you what you'd be able to wear. Usually when you have your surgery, the surgeon will send you home with either a binder or a camisole with drain pouches, and you'll wear that for 1 to 2 weeks. You can come see us then once the scabbing is completely, once you're completely scabbed over and the swelling is fairly down, and then we would fit you with a transitional or a leisure form. And there's a couple of different kinds. One you can see is just like a little soft foam with a fabric covering over it. And it just comes in one shape. It's kind of stiff and it's not super comfortable, but it's a great option until you're ready for a silicone. The other option is, people call them a bean bag. It's got like little micro beads in it, and it feels like a bean bag, but it works really great because then people can use it for swimming afterwards. And if you have a surgery that was kind of lumpy and bumpy, which happens sometimes, this is a really nice option because it doesn't rub. It kind of fills in those little crevices and grooves, and that's an option that a lot of our ladies like. So that will be something that people will do anywhere from 2 to 6 months. It just depends on the person, how much they heal, if they're going to have radiation. You can't get into your regular mastectomy bra and a silicone prosthetic until you're done with radiation, the swelling has gone down for that, and you're pretty much where you're going to be for a while, because the prosthetics are 2 years. It's their rule of life is 2 years. So you don't want to get into something that's not going to fit you in 6 months. And then when we get to that point, like Sandy said, there's a lot of different options. She talked about these. This would be something that we use sometimes when people have one side that's reconstructed and the other side is missing, because that reconstructed side is kind of round, and the prosthetics, as you can see, are not. So this would go in kind of on the side, and that matches really well when you have one reconstructed side. The other thing we can use is something like this, where you kind of build your own. It's a nice option when somebody's got a difficult surgery or when they're doing expanders. And you can just kind of put these in, they stick and it adheres to your skin, and they can kind of figure out, it's almost like a custom, but you build it yourself. And then the other option that's really new, you put this in, and this works really well with people who are very uneven. You put it next to your skin, I should have your lady, and then pump it up, and it fills in whatever crevices you need filled in. You pull this out, and it stays inflated for 3 months.
Oh, wow.
And so
Do
that
you guys
works.
play that song when you demonstrate that too? Pump it up, pump it up.
It works really well with people who are kind of a difficult fit, and that's kind of a new product that we do.
So back to the one that you would use like during the time period of having the expanders. I don't think most people would even think about having the prosthesis during that time. Can you
Okay.
explain that just a little bit?
Yeah,
Or?
so when you first start, you're going to need, before you have really expanded, you're going to need kind of a regular prosthetic. And each time you go in, you are a little bit bigger, and so you can take out a little of this until you get to be where you're done. And then again, sometimes we'll use something like this for projection, even after the reconstruction. But yeah, there are a lot of people that do the expanders that are gradual, like to still have something when they're going to work that makes them feel normal. It makes their clothes look fit well, and this is kind of a nice option for them.
So insurance would cover that one?
Absolutely.
For them, and then there would be no need that they'd end up needing a different one?
Probably not, unless they just need a smaller one of the shapers.
one.
For projection would be mostly what that would be used for. Yeah,
A lot.
and insurance absolutely does cover that.
A lot of times the reconstruction is very full, but also very flat in the front. And so it doesn't fill up a bra as your natural breast would. And so that is why those little partial triangles will come in, they come in very handy. And obviously they come very small and they come very big. There's all different sizes and shapes. And they're also the one that is, this one that was inflated, I always forget the name of it. Adapter. They are coming out with a partial ones, so they will be similar to these, different shapes and sizes, and that you will be able to
Still pump?
put them up to whatever.
And
So for that pump one, does that detach then?
you take that off, and it stays inflated. And then the really nice thing about this too is people who have lymphedema, sometimes their size, because of their swelling, may change
Yes.
up and down and up and down and up and down. And so Lori, you know that well. So this is really nice for them because they can inflate or deflate as they need to, so that they match their other
Right.
side.
Well, that's
even with
cool. I
lymphedema.
didn't know they had those kind of out.
Yeah, it's
It's
a pretty
something
new
new,
thing,
yeah.
and it's really great for some patients.
Yeah.
So one of our viewers has a question for you. So 2014 is when she got hers, and it's very uncomfortable, and she doesn't like her bra. So.
Well, it's time to get new.
Yeah.
Because,
Just about everything you see on the table
Yeah.
is new from 2014.
yeah, they become much more realistic feeling. They're all 100% silicone, but there are so many different weights. Some women, a lot of women will come in and they'll complain about, this is so heavy, but it'll be something that they got quite a while ago. Now, if you have a natural side that is also very heavy, maybe you have a D cup or a double D cup, you do have to balance that out so you have some sort of balance with your body, so that you're not leaning to one side. The other thing is it will shift. It will shift to the heavier side. So if you put you have a natural side and you have a mastectomy on the opposite side, you can put a bigger prosthesis on there that's extremely light, like say someone wants this, which is our post-surgery one, and it's just foam. Your bra is going to constantly be going to your natural side because it will always shift to the heavier side if there is a big imbalance.
So is there a set weight, like if you're a D cup, this is, you know, your prosthetic should weigh this much, or if you're a B cup, it should weigh this?
No.
And do different brands have different weights? Like, is a B in this brand lighter weight or heavier than a B in this brand?
They all have different.
It's really not the brand so much, but the style. There are, they all are assigned different numbers and categories, and they have different weights within every company. And it's part of it is so that we can best match the other side, and part of it is for comfort. Because certainly someone that's 90 years old and really having trouble with osteoporosis and doesn't want to wear a bra that really fits well, we're going to put them in something lighter. I see one of the questions is, does the pump go in a pocket? So I should have explained, when you fill it up, you do it straight on your chest. But then when you're done, you take this out, and then you can put it in the pocket. So you don't keep the pump in it, and this still goes into your mastectomy bra, your pocketed bra.
And it stays that way. So let's say you have more surgery or whatever. Maybe you have a very irregular mastectomy surgery site. If for some reason you would have it, straightened out a little bit, or you had a weight gain or weight loss, then you could resize, so to speak, the other kind.
So you say the bra will always shift to the heavy side. So when a lady comes in, how do you determine what weight she should have? Because, like, how do you measure this? Like, my mom has one, and I hold it in my hand. She's like, this thing is heavy. And I'm going, yeah, I think it's a lot heavier than mine.
They're always going to feel heavier when it's off of you than on you.
Yeah.
If your bra is fitting properly, which is comfortably snug, that prosthetic should be close to your chest wall, and then it's not going to feel as heavy, no matter how big or heavy it is. But to determine really the size and the weight, we do measurements when they come in. We talk about what their needs are, what their personality is, what kind of activities they do, and then we try on different prosthetics and see what really matches best. I mean, we know we have a good idea from doing it for many years, but we do a little bit of puzzle putting together when the ladies are in our room.
Yeah. It's a lot of trying on different things.
So a question is, I'm having surgery, will be flat. Are there ones that just fit in the bra that I can wear with dress clothes?
So I'm guessing she means a regular bra.
No.
Easy answer, yeah, no.
Well, there aren't, there are custom-made prosthetics. We do not do them in our boutique, but there are certain ones that can be, they're very expensive product. They're over $3,000 they bill out. But there are women who choose that, and they can be worn in a regular bra. But I would encourage anyone who wants to do a custom to have a consultation about both, so they can make a very valid decision on that. Because sometimes your surgery changes, and then you're stuck with that prosthesis that doesn't fit, and you can only bill them out every 2 years, and you've spent a lot of
the custom
money.
I think is even 5 years now. One thing that we could talk about though. If you're a year past your surgery, you can wear a contact form. Is there one in there I think you could pull out? And that sticks to your skin.
Yeah, I forgot about that. I apologize.
But you have to be a year past your surgery and not with super sensitive skin. I think it's
So this is a partial, and it comes with a back, and they're very, very, very tacky. Now, if you have very thin, fragile skin, or you have any kind of, you're one of those people who has that type of skin that everything welts up or has irritation, probably not the one for you. But, they do make them. And they make them in full prosthetics. They can be worn during the day. Then you have to clean them every every time that you wear them, you have to re-clean it. So it's an everyday thing, where the silicone that are in the pocket do not have to be cleaned every day.
So even those kind, they stick to your skin, so that you don't have to have the pocket, but you
Right.
still need to
Don't.
be wearing the bra.
Yeah, I
Well,
probably would.
likely it's going to be supported much better if you do. Yeah.
The other thing is bras really come in many varieties now, so much more than they did even 5 years ago. We've had a lot of women lately that have come in because their daughter's getting married or someone's getting married, and we have strapless bras. There are bras that look like the cute little boutique that I can't name, that are lacy and really thin and sexy and colors, and it's not just
Your grandma
old
bra.
They're not
fashioned grandma
orthopedic
bras.
looking
Yeah, they're
like
not
they were
orthopedic.
some years ago. Yeah.
There's ones with
So-
some padding, ones with some lift. There's really lots and lots and lots of options.
Yeah.
So that has not really been an issue for people. We can
Yeah.
we can
We can usually
figure out something
find-
to go with
yeah.
just about everything. And we'll
Yeah.
have women that'll bring in the dress that they're going to wear to a social event, and we'll find something that works great with that.
Yeah. And your insurance covers it, so bring
And
it
your
in
insurance
and
covers it.
have them figure it out for
Yeah.
you. So
That's what we do.
Yeah.
So that one, can stick. Some of them go in the bra. Can you tell us about the magnet ones?
Magnet ones?
Yes.
No.
No.
About that.
Okay.
Never heard of it.
Really?
Yeah. So you don't. So
No.
this is a true story. Can't make this stuff
Like
up, ladies.
eyelashes or
This is a true
something?
story. So today I was treating a patient and was chatty, and she asked me what I was doing tonight. So I told her, and I said, "Hey, do you have any great questions for me?" And she has one of those beautiful custom-made ones. It was $4,000. She said, "It's beautiful. It looks nice. Came in this nice little bag. It's got embroidery on the outside of it." She says, "It's beautiful." And she said it's magnetic, and so it's supposed to stay there. But she has a little bit of a belly, so when she sits, she has a shelf. And so then the magnet isn't quite strong enough, and it just kind of migrates up to her
my
neck.
Goodness.
And so then she has a boob at her neck, and so she's not very excited about her $4,000
Yeah.
boob. So she was telling me about this, and she said, "So usually what I
Wow.
do is I just get some Uncle Ben's rice and I put it in a sock, and that's what I'm using because I don't like my $4,000 custom
Oh
one."
my goodness.
Unfortunately, that's what we have heard a lot of people
Yeah.
kind of complain about the customs for one reason or another. So back a few years ago, when we opened in 2007, they were very time intensive, and we did do some. And you basically made a cast of their body, and they had to stand still for a while, and you had to really make a casting of it. And it took a long time to get it and all of that. But so it's quite a process. It's a much faster process, but
And those stick on magnetically, she said.
I
was
have
like,
never
"Wow."
heard that.
Okay,
Mm-mm.
that's hers.
Something for us to look at.
She said
Yeah.
her friends give her a hard time. Do you got
Yeah.
Uncle Ben with you tonight?
Oh my gosh.
Well, we've seen those things. We've seen lots
Yeah.
of
Oh.
things come in that people are
Beanie babies,
substituting. Yeah.
mittens.
Beanie
Yeah, we've seen
babies,
it-
yeah.
we've
Well,
seen it all.
maybe that's where they got that idea for that other one.
Yeah.
Exactly.
Yeah.
Exactly.
Yeah.
Do you want to talk about the swimwear and those forms?
Yeah, so we also have swim forms. These are actually the regular silicone are you're able to use them in the water as well. You would need obviously a pocketed swimsuit as well, which we do carry. But if you're gonna do water aerobics and you're in the water and it's chlorinated, it's not gonna be really great for this. So it's not made for that. So then that's where this one, which is also can be used as the temporary form, is can be put in your bra or your swimsuit, and it's very easy to care for, and these work really well in the swimwear. But they also do have silicone ones, which is like this. They're hollow. They're hollow on the outside or the inside here, and the water flows and kind of it makes it more buoyant when it's in the water itself. These are a little bit more weight though, so some women don't want to do that. Where these are very lightweight.
And less expensive.
Yeah, and insurance will not cover a swim form or a well, this one they will cover because we can bill it as a
Transitional.
transitional. Yeah, I'm not thinking of my words, but yes.
The other thing that is maybe a little bit unusual for most people until they think about it is when women have had reconstruction, they're not always able to do nipple conserving surgery. And so sometimes we have this breast that doesn't have a nipple. Some women choose to get tattooed, which is a great option. But we also have nipples. And these are adhesive just like that bra that we talked about. They come in different sizes and colors. And that's also been a really new thing for people that has been great for some women. Some people don't care, and that's fine. But some women really feel more comfortable if they have that. So that's just one more option that's out there.
And those just stick on?
Stick on just like that little adhesive one, yeah. And these are also insurable and are covered every 3 months.
How often, would that stick last for you? Like, does it really last for the whole 3 months if they're wearing it every day?
In fact, the women that I have can really go longer than that most of the time.
That's awesome.
Yeah, you take it off at night if you want to and wash it and put it back on.
That's awesome.
Yeah, it's really
There's something
it's
for
a great
everyone.
option. Yeah, it's come so far even in the time that we've been doing it. It's amazing and it's wonderful. But you have to get in there and find out what's available to you, I think.
Yeah.
It's interesting. What do you think, when women are trying to decide which route to go, they really should come and visit with someone like you guys first, just so that they have a complete
You should
understanding.
mention that.
We didn't bring a book, but we started a program about, it was right before coronavirus started. And it was pre-surgery consults. And so now we have several surgeons in town who actually request that their patients come and see us before they do surgery, no matter what option they're going to have, just to see what all the options are. And we found that women are just relieved to know that they have options and that it's not going to be a granny bra and a plastic hard prosthetic.
Yeah.
It's been a really, really good program. We talk to them. It just takes about a half an hour. We give them a book that's been put together with different support organizations and exercises that they should do after their surgery. And it's kind of been a great program.
Yeah, it's been really great.
Yeah.
Do you have the questions? I don't have the questions.
Yeah, they're just kind of incorporated in here.
How about hot?
Sweet.
What's the temperature like for them?
Well-
I have a couple of patients that say they don't wear theirs because
they're
they're
too hot.
too hot. So I don't know if it's
Yeah.
how old theirs are, but that's something I
Yeah.
hear a lot.
So we don't have any with some
This is
will have
Comfort
these are the Outlast. Some have little ridges in them which help with airflow. But the white that's behind some of these it's called Outlast, and it was developed for the astronauts to use in their spacesuits to keep the temperature kind of the same. So if it's hot outside, these stay your temperature, not the temperature of the heat outside, and the same thing with cold. And so these are really good if people tend to get hot.
Yeah, they they tend to if you're in and out of the car in the summertime, it's going to be hot. It's I don't know, but these should not add much more heat to your body. But and we've had really good response from those. They are a little bit lighter weight and they more comfort because of that. A lot of women, sometimes these are also can be used for like exercising, gardening, walking, whatever you're doing. They're more of an active form. So whatever you do, on in your daily life, and they can be a little bit cooler as well. So, and that's one of those things when the patient comes in. That's one of those things we want to ask a lot of questions, so that we can really make it custom for them. This would be a great idea because you can wear it in the beginning. It's going to be more comfortable. It's softer. But then, afterwards you can go swimming in it, or you can do your aerobics in it, or.
It's a really cute little boutique. It's decorated really feminine and girly. And we bring you in and we take you, Sandy and I each have our own fitting rooms that we've got kind of decorated. And the first thing we do is register you as a patient, because those are the kinds of things we have to do in a hospital. But then we talk to you. Like Sandy said, we ask you all kinds of questions about what are your activities, what's your daily life, do you work, do you have grandkids? We want to know. We really want to talk to them about their day so we can figure out what's going to be best for them. And then we start with measurements and you kind of take
Yeah, so then we do measurements, and then normally we will try, there are certain bras that we like to do our fittings with, because we can really see a little bit more what your balance, and that's what we're after. And so we will fit different forms on you, different bras. It usually, the first initial fitting can take about an hour and a half with paperwork and all of that. And it goes much smoother after that. That's when, we try to bring the newer stuff in so we can see it, and so that the patient can see it too, see that there are new exciting things that are out there. So.
We work with about 5 vendors, so we've got a big variety because everybody's needs are a little different. If we brought in, 5 prosthetics and without measuring you or anything, they're not all going to fit, even if they're the same size. So we deal with quite a few vendors to get the best prosthetic for you and the best bra for you. And we keep a pretty big inventory on hand, but we also will order things that are directly, what you need.
So we have to have a prescription for any of these things. So we discussed that with you initially. So we have to have that in our hands when you come in for your fitting. And then, so if we have that product available, we will send you home with it right then and there. Now, if we don't have it, then we can do the ordering. We can ship it to the patient, or if we know exactly what it is they need.
Most of the time, how long does that take if you special order something? Couple weeks? Couple
1
months?
to 2 weeks, yeah.
Just a
Just
few
yeah,
weeks.
it just depends on what company.
Yeah, just a
Some
couple
are a little
weeks.
bit quicker than others, but yeah. And Chris does, she does the ordering, and she's pretty on target for that, so she gets that done.
I try to do that every day, and then we order it from the company and send it directly to the person's home. So we have one company that's out of Germany, and that sometimes takes a little bit longer, but for the most part, it's a week to 2 weeks tops.
So we did a lot of that during the COVID time, so that patients didn't have to come in and.
So other than measuring around the chest, what other measurements are you taking?
We measure, let me get my lady here again. So we're measuring, I didn't bring a tape measure, but
Because that's, I think, one of the reasons I asked that is because, several times I've had patients say they just have a hard time getting it to stay in place. And so I imagine it's because it's not fitted right.
sometimes it's just a matter of an adjustment with your connections in the back and strap adjustments. I mean, it can be just that simple sometimes. Or, so we're gonna measure around the band, and then we're gonna, and there's a couple different ways, but I usually measure from the middle, which I can't see really good here, and the fullest part of the breast back to the center in the back. And then, so when I'm doing that, then I measure again on the other side and see how much it's off, or if it's really good.
That helps you determine the size.
It determines
That makes
the
sense.
cup size, and it also it's your measurements need to be pretty on target. So,
And once they have a bra on, you would do those measurements again with the prosthetic, and you'd also measure from here down to see that the apex is at the same place.
so
you want to make sure that
doing it from here down to the, but
and then from here to the side of the bra, because you want to do lots of measurements so you can know that it's really a good fit. And then we usually have them sit down to see how it looks and feels when they sit, and raise their arms to make sure it's not pulling up. If they're able to, maybe do a little moving around if we know that that's something that they're going to do. So we really do work with each person individually to find out what their best needs are going to be. I know one of the questions was, if you're unhappy with where you're going, can you go someplace else? There are two credentialing organizations. They're BOC and ABC, and you can find out if there's a fitter in your area. A certified mastectomy fitter is what you're looking at. So some of the smaller towns don't have anything, but you can find something that's close.
And in Omaha, you're saying there's several places they can go, but
There
they're
are-
always looking for a certified fitter. Are there people who
there's
do it that
two
aren't
other
certified?
places that do it that I know of. There used to be several people in town who did it and weren't certified, and because of insurance, they weren't really able to do that anymore. So now I think there's just 3 of us. I think there's 13 fitters in the state of Nebraska, if that tells you anything, and we have
Oh,
2.
wow.
So it's not something that a lot of people,
Yeah.
we're not easy to find.
So, any suggestions for those other than their bra, adjusting their bra strap, for the ones who are struggling with getting it to stay in place?
It may be the wrong bra, it may be the wrong prosthesis. They may have been fit incorrectly, or they've had some body changes, and it might have fit correctly initially, and now it needs to be reevaluated. We like women to come in once a year. Now COVID kind of changed that, obviously, but we like them to come in once a year. And new patients, sometimes it's good for them to come in at 6 months and see how things have developed. Their needs may have been they needed a very soft bra in the beginning. It was post-surgery, but now they're ready for everyday wear, a more normal type that they would prefer. And in that healing process, they may have changed a little bit too.
I think that's a really good point, because I think what I see is lots of times people think, okay, I have it, so now I'm done. And they'll complain about it not staying in place, and it's like, well, how long have you had that bra? Oh, I don't know, I got this in I don't know,
Yeah.
2000
Right, it
and,
can be all stretched out.
because
Yeah.
all of us need new
Right.
bras.
And that's even more important when you've
They
got
get
a
stretched
prosthetic. We like to tell women that we would like to see them wear it comfortably snug. And the reason for that is if your bra is loose, this prosthetic is going to pull away from your chest, which is going to cause your shoulder to gravitate, and that's really not good for anyone. So we want that prosthetic to stay close to your chest wall. So you really do need to replace your bras when they start getting stretched out, because it's not good for you.
Right, and then the other thing is, a prosthetic is warranted for 2 years. So at about that 2-year period, they're gonna get real soft. They're not gonna have the same shape. So someone who's had it 3, 4 years, some women will wait quite a long time.
So a lot of ladies don't feel comfortable going, and they have a hard time looking in the mirror. They maybe haven't really touched themselves very much yet. They want to do something, but it's just, they're having a hard
They're
time
not
touching
ready.
and looking, and they certainly don't want to come and have you touch and look. Like, how can you help women, and suggestions for that to help get them over the hump to get them in your door?
Well, the first thing we do is we bring them into a private room. So it's not very clinical. You're not in front of anyone else. And before we even start with the fitting, we usually start with, tell me your story. And they talk to us and they tell us what their situation is. And by the time they've opened up, we've got a little more, feedback both ways. And it's just a lot more comfortable at that point in time, I think. And then it's easier for them. And we try to be very respectful of, we know you have to take off your shirt and we've got to do measurements and stuff. But we try to do it in a way that they don't have to expose themselves.
Yeah,
any
we
more
have
than they
gowns,
need
of
to.
course, and everything, so they're, we want to respect their privacy as well.
And the comments that we hear all the time are, you made this so easy. Thank you for making it so comfortable. So I think we try to lighten it up a little bit and take the fear away at the beginning. And sometimes that's a nice thing about that pre-surgery consult too, because we've already established a relationship. And also one of the things that Sandy does is cosmetology. So sometimes they've already done chemo and established a relationship with her because she's removed their hair and fit them for a wig. And
So if they're in there and they are a breast cancer patient and they've, I talked to them a little bit about what kind of surgery they're having. If they come, if it's a situation where they're still having a lumpectomy or they're having reconstruction, I always try to let them know you know, you can still come here and get bras. And if anything changes or surgery is not quite balanced or you're having difficulties, let us know. We probably can help you. We probably have something to help you with. So I'd like to kind of put that bug in their ear, because so many times when I've gone to health fairs and lots of different things, women say, well, I had a lumpectomy, but look, you know, I don't, one side's much bigger than the other. So, you know, it's really important for them to know that they can get insurable items. But yeah, in the cosmetology's part of it, when they're choosing a wig or just removing the hair or both or whatever, that's a pretty intimate moment there. So I talk to them a little bit if they're having their surgery after treatment. I do, you know, try to bring some of that up and say, you know, after your surgery, you know, give me a call and I can help you with that. So it's you do build up a relationship with that person, and of course, if they are wearing these things, if they're wearing prosthetics and getting mastectomy bras, it's for life. So, you know, we really try very hard to be, to make them feel as comfortable as possible, always.
So I'm sorry, Chris, you said earlier, and how soon after, if they're not doing radiation, how soon after the mastectomy can they come in?
They can come in when they're scabbed over and
yes.
most of the swelling is done. And then that's when we fit them with the initial, the transitional forms, like this and this. And that would be just a really soft bra. We have a few that we really like. They're kind of a leisure or a post-surgical bra that we'll do. And then at about 6 months, normally 2 to 6 months, we can fit them in a regular silicone prosthetic and bra. And the bras, like this is a really nice, comfortable bra that they can wear, but there's ones with padding, there's ones with lace. If they're really large and just had one side removed, they're probably going to need something with a lot of support and seams. So we have lots of different options.
We have a plethora of bras. They're everywhere in there, and we have every shape and size. But there are some times where we need to order.
Yeah.
You know, we'll have every size but the one they want. So.
I think one thing that we maybe didn't touch on earlier when we talked about a lumpectomy and radiation, sometimes when you've had radiation, you can continue to shrink on that radiated side years down the road. So maybe you had a lumpectomy 5 years ago and it was great and you really couldn't see any difference, but then it's going to continue to shrink for some people, not everyone. And you might need something 5 years down the road or 10 years down the road. So there's always, you should always be looking at what your needs are then and not just assume that you're done and you're okay.
For the transitional ones, for the people who come in early, does insurance pay for the transitional and then the real deal in the same year?
Yep, sure does.
In the same year, you're
Yep,
fine with that.
absolutely, yep. Most insurance company will do 2 of the post-surgical camisoles with the drain pouches, and then 1 of these. And then average is probably 3 bras every 6 months. That's what Medicare is, and that's what most of them are. And then these every 2 years.
So you can
after
get
this.
the transitional one and the
And
real
this,
deal in
absolutely.
the same year.
Yep.
Yes, and
You need about a month between.
Oh, that's all.
the
Very good.
physician won't want you, the surgeon won't want you to have anything weighted, and you know that's pressing on your surgery for a while. So that's why you have to have something lighter.
You know, you spoke of balance several times. You know, another reason why I think it's really important that women either see you or do the expanders, or now I know they can do both for a while, is because, you know, especially if they're a large person, there's a lot of weight missing here, and it just starts to have compensation things going on in the spine and the shoulder blades, and that compensation can cause a lot of pain. And if there's somebody who's a little frail maybe, or have arthritis, you know, it really affects that shoulder joint as well. And so you would think it shouldn't hurt the shoulder any because there's nothing there, but it does because they just kind of posture it different.
Yeah.
And if they're a larger person, they posture it different because they start to kind of lean to the
Absolutely.
direction
To the
of the
heavy
one
side.
that's
Of the
still
heavy side.
intact.
Absolutely.
Now, if both of them are off, then that's
That's
different.
fine.
Because then they're balanced.
Right.
But when they leave one on, especially if
Right.
it's heavy, you know, there's some concerns about that just with pain and posture stuff down the road. Do you guys ever
Absolutely.
get people who come in and talk about that?
All the time. And we really try to encourage women to wear their prosthetic even when they're home for that very reason. They think no one's going to see me, it doesn't make any difference. But you know, my shoulder's really been bothering me. Well, that's why you need to have that balance, and you really need to wear it all the time. And you can wear some a little bit lighter if you're just going to be home, but you really should wear something because you're going to have problems down the road if you don't.
Yeah, it's crazy how you don't think about that
it
kind of
is,
thing, but
yeah.
it does make a difference.
Yeah.
Absolutely, it does, yeah.
So, is there any particular ones that are like the go-to that everybody seems to really like? Do you have a hot seller?
For prosthetics?
We have kind of preferences.
Yeah, we
sometimes.
do.
But
Yeah, it depends on if you're bilateral or unilateral. That really makes a difference. If you're bilateral, we kind of like to go with something that's light and comfortable and cool, because it doesn't make any difference if it doesn't match. I mean, they're going to match because you've got two. But when you're unilateral, you really kind of have to just match it more. There's not really a one choice fits all.
no, it's you just have to keep trying into different ones. Sometimes I've even had to use different sizes, the same
Oh yeah.
style of prosthesis, but different sizes because there's more. When they had the mastectomy, there's more tissue on one side than another, so naturally that sticks out. There is one of these is a. This is the right. So we also have asymmetrical ones. So this one has a little bit of an extension that would go underneath the arm here a little bit. And sometimes when you've had a lot of lymph node removal, that makes a
be
difference.
nicer.
You need to fill that in and pull that bra out a little bit so it's not cutting under here. You know, we know with
Right.
lymphedema that's no. And
Well, it just irritates too.
and it is irritating.
Even if they don't have that.
On
they would
top
dig
of that,
in.
yeah, they've had, that's one of the most sensitive places where they did the lymph nodes.
So those who are out of the Omaha metro area, if they're in central or western Nebraska, do you know any fitters in that area? Or tell us again how they would find them.
Again, I would say look up ABC or BOC. I'm not sure what ABC stands for, but BOC is Board of Credentialing. It's an international organization. ABC is a national organization. And to be certified, you have to be registered with one of those two places. They have websites, and you can put in your zip code, and they'll match you to a certified mastectomy fitter near you.
Oh, that's awesome. Very
And I
good.
think that gives you like health grades like everything else. You know, is this
Yeah,
person got
I
4
don't-
stars or 5 stars or...
yeah.
And we have another question. Do any come with nipples?
Well, they all have a little tiny nipple on them. They're not a different color, but you can use a form and then apply a nipple on it.
Can you put those nipples on there? Can you show those to them again?
Yeah.
So can you pull one of those out and put
I
it on
will.
to show us what it really
Yeah.
looks like?
Yeah, so it's really thin. It's paper thin, the areola part, and then the nipple is it's got a little raise, and like I said, they're different sizes and different colors. So some are a little thicker. The nipple sticks out a little bit more. So you would just put it in the place, and it'll stick right on there.
Yeah.
Ta-da.
Wet t-shirt concert.
Yeah,
Here I
you're
go.
good to go. Yeah, and you can choose the size and the color. So it's really kind of a neat little thing.
Absolutely,
Yeah.
Yeah.
So what is your recommendations for people with a concave chest?
We didn't bring one of those, did we?
Those are tricky because some are so concave that you're not going to fill that in. There's, you know,
This is a really good option for a concave chest because
Pump it up,
You
baby.
can pump it up and it just fills
will, yeah.
that right in.
fill into it.
This is probably what I've had the best luck with somebody who's really concave personally.
And you want to find a bra that's going to fit pretty flush against the chest wall. so that when they're bending over, it's not gaping, and so you really want a good fitting bra if that's your issue.
But if they have a concave chest, then they just need to have their fitter. The fitter can figure it out for them.
Absolutely, they should be able to.
Yep. Well, that's
do the
great.
best we can.
You know, it's not always going to be perfect. We can't recreate what you came with. You know, it just doesn't work that way. But we can
Yeah.
come really close.
We'll work really hard to make it right.
And that's why we use so many different vendors and have so many options, because we want to be able to get the closest we possibly can.
That's great.
And I think we're kind of picky.
I have. If somebody has to change their insurance companies, will it be difficult to get coverage with the new one?
Not at all. It's
Because they're required to do it.
They're required
Yeah.
to do it, so it's not a problem. The only thing that we would say, there are some insurance companies that require pre-authorization, which can take a while. So if you're with an insurance company that doesn't and has really covers like 6 bras a year, and you're going to go with something that does require pre-authorization and covers 2 bras a year, you might want to do it before you switch over. But otherwise, it's not a problem at all. We do have you call your insurance company to see what your coverage is, because that varies from policy to policy. So you need to make sure you know. You know, we know what the general things are. We know what Medicare is. But if you've got any of the private insurance companies, we do ask that you find out. We'll give you the code. You can call your insurance company and find out what your coverage is.
Yeah.
If they have, it also could be in your advantage if you're changing insurance companies. If you've met your deductible, if there's a few things that you need, you could purchase a couple of things before you change your insurance, and then, you know, your new insurance would
Yep.
Yeah.
start over and you would have additional items. So you can always
Yeah,
look at that
absolutely.
option as
Yeah.
well.
Yeah.
One thing I do want to remind people too is it's just like with any other medical expense, you have to meet your deductibles and there may be a copay. So when we say it's covered, that doesn't necessarily mean it's going to be paid at 100%, because you do still have those things, just like with anything else medical. It is considered, you know, a medical item.
Yeah.
So I know that you guys are from the CHI, Renewal Hope Boutique. Is there anything, what all do you do at your boutique? Anything else you'd like to share? What other products would they find there other than bras and prostheses?
We have swimwear and fashion camisoles that aren't covered by insurance. We have lots of gifts, books, jewelry, things like that. Things that are some things that are locally made as far as the jewelry. And then there's
Yeah.
Sandy's area.
Yeah, and well, I have a lot of. I usually try to help the people with their hats and soft caps if they're going through hair loss. So I have a separate, you know, private room that I do all that, and the wig fitting, of course. And we also have a lot of. It's very boutique-y. I don't know how to say that. Yeah, but we have some really cute things that would be good as gifts for a friend who's going through some difficulties. Yeah,
So it's
there's a lot
open
of
to the
fun.
public. They
It
don't
is.
have to be a CHI.
Oh,
individual.
no. We see people from everywhere, including
Yeah.
other states. We've got some people who may have moved someplace else, but they come back once a year to visit their daughter, and they've been so happy they want to stay there. Tons of hats and things. We have a lot of people that just come in and buy scarves, because we're
Oh, yeah, we
really
have a lot
known
of
for our
scarves,
scarves. But yeah, lots of little gift items, and we do ask people to make appointments. If Sandy and I are both with a patient, then the doors will be locked. But if the doors are open, anybody can come in and shop.
Yeah, we try very hard to not both be busy at the same time, so we can accommodate people.
That just walk in.
Yep.
Yeah. So they just need a script from their physician if they're getting something that's covered through their insurance, the bras, the camisoles, the mastectomies. Otherwise, the other stuff, wigs. Otherwise, they can come and just
Yeah.
shop in your store without the script from a physician.
Yes, but a lot. So I do ask them if they are wanting a wig to check with their insurance to see if they're covered, and that is an appointment thing as well, obviously. But yeah, But if there's any questions or anything, we just encourage you to give us a call, and we'll direct you. We'll give you what information we can give you over the phone, and then proceed from there.
Do you guys have a Facebook page
We do not
Just
have a
CHI,
Facebook
you know,
page.
sometimes there'll be something about us on the CHI
Yeah.
page, but we don't have our own.
No.
Nobody to maintain it. We're too busy fitting people.
Too busy doing the other things.
that is the
Yeah.
truth, yeah.
Well, we thank you very much for sharing your
Absolutely.
knowledge with us tonight. We
been a
really,
pleasure.
really appreciate
Yeah,
that.
It's been a good time.
So I would like to say thank you to all of our donators who allow programs like this to happen for Project Pink. From the moment of diagnosis to the end of life, Project Pink provides tools and resources and a strong network to strengthen and renew your mind, your body, and your spirit for all the breast cancer survivors in Nebraska and Western Iowa. And that's made possible by our generous donators. So thank you very much for that. So ladies, we also have some other exciting things coming up, so please check out projectpink.org. If you're a new breast cancer survivor or if you're a survivor with METS, every other month we alternate and we have social Zoom hours, and we'd love to have you join us for that. And we're very excited that starting May, the first Saturday in May, we're going to have sunrise yoga. And then we're going to start a walking club in Omaha and in Lincoln. We do ask that you go to the website to sign up for those. We have lots of exciting things. So thank you, donors, for all of that. And thank you, ladies and experts, for being with us tonight. Appreciate it.